The Clostridial organisms are usually seen in the soil. In the soil, they can survive for a longer time. Along with that, the Clostridial organisms, most of them are present in the gastrointestinal tract of ruminants. So there are many Clostridial diseases that can affect goats, like the endotoxemia, tetanus, black water, black disease, red water disease, big head disease, or the botulism. So there are a number of diseases that affects the goats. But some diseases are more important, and early diagnosis of endotoxemia is very important for the management of endotoxemia cases. And even though we diagnose tetanus early, it may be difficult to manage tetanus cases. So, a thorough knowledge about clostridial diseases is important for the effective prevention and control of diseases so as to maintain a good herd health management. So, I will be discussing about the most important clostridial diseases in goats. So the peculiarity of the Clostridial organisms is that they are seen in the soil, they are seen in the gastrointestinal tract. So we need not search for any source for this Clostridial organism. It's already there. And the peculiarity of the Clostridial organism is that they produce toxins, and this toxin cause the clinical signs. And based on the location in which these organisms are seen, they are categorized into some types, like the gastrointestinal means they are seen in the gastrointestinal tract, like the Clostridium septica organism, Clostridium sordili, or the Clostridium perfringens. And neurological, like the Clostridium tetani and botulinum, they act mainly on the nervous system. And histological, which acts on the connective tissues or the muscle tissues, like the Clostridium shauve and Clostridium novae organisms. So these are the various Clostridial organisms that cause various diseases in livestock. The Clostridium tetani, which causes the tetanus, Clostridium botulinum, that causes the botulism, Clostridium shauve, which causes black leg or black otter, Clostridium septicum, that causes malignant edema or braxy in case of sheep, and Clostridium novae, this type A, which causes gas gangrene as well as big head disease, and the Clostridium novae type B, that causes infectious necrotic hepatitis, Clostridium hemolyticum or the Clostridium novae type D, that's the previous name of Clostridium hemolyticum, which causes bacillary hemoglobinuria. So these are the most commonly seen Clostridial diseases in goats. So the Clostridium perfringens organisms. For the Clostridium perfringens organisms, there are several exotoxins. At most 5 exotoxins are there. Type A, type B, C, D, and E. The Clostridium perfringens type A causes yellow lamb disease. Type B causes lamb dysentery. Type C causes struck in sheep. And type D causes the endotoxemia. And there are 4 toxins that is elaborated by the Clostridium perfringens, like alpha, beta, epsilon, and iota. So each of these type it will produce different of these toxins, like the type C produces alpha toxin and beta toxin, and the type D endotoxemia produces alpha toxin and epsilon toxin. Like that, it produces these toxins also. So now we are going to discuss on the most important or the most common or the most fatal diseases of goat, endotoxemia. As the name suggests, it is connected with toxemia in the intestines or the overeating disease, pulpy kidney disease. So coming to the disease, the principal cause of caprine endotoxemia are the Clostridium perfringens type D organisms, which are gram-positive organisms, which are spore-forming, anaerobic. They are non-motile organisms. They are rod-shaped bacteria that are the normal residents of the digestive tract of ruminants. The peculiarity of this organism is that they have a quick generation time. The generation time is almost 8 minutes. So that under favorable condition, there will be a rapid proliferation of this Clostridium perfringens organism, which will results in the release of toxins. The toxins released are the alpha toxin and epsilon toxin, among which epsilon toxin is the most important one. So the rapid proliferation of the Clostridium perfringens organism and along with the release of the toxins alpha and epsilon, which results in disease in the host. And the risk factors that are associated with endotoxemia, the excessive grain consumption, sudden intake of readily fermentable carbohydrate. That is the main risk factor that is associated with endotoxemia. It could be a grain, it could be bran, or it could be intake of flesh, pasture, or it could be an excess intake of milk. So these are all causes endotoxemia. Along with that, heavy parasitism, like especially the tapeworms, they can obstruct the intestines. So that will also predispose to endotoxemia. So these are the risk factors associated with endotoxemia in goats. The sudden intake of excess quantity of carbohydrate, less pasture, milk, and the parasites also predispose to the condition. So coming to the pathogenesis of the disease. So this Clostridium perfringens type D organism, they are commensal organism that are seen in the gastrointestinal tract of these goats. But they won't cause any damage to the intestines. Usually they will be there. They won't cause any damage to the intestines. They will produce toxins and these toxins will be removed from the intestines by the normal peristaltic movement. But whenever there is a sudden intake of readily fermentable carbohydrate or any other carbohydrate rich food, there will be undigested starch moving from the rumen to the abomasum and to the intestines. And also, when there is a huge intake of carbohydrate, there will be the movement of the ingesta will also be reduced. So, along with the undigested starch that is present in the intestine and the reduced motility of the intestines due to the huge amount of carbohydrate, and sometimes there will be tapeworms also that will also predispose, that will reduce the movement of the ingesta. So all these anaerobic conditions, all these conditions will favor an anaerobic environment that helps in the proliferation of Clostridium perfringens organism, which will produce the toxin epsilon toxin. And the proactive epsilon toxin is converted to an active epsilon toxin by the trypsin that is present in the intestines. And this active epsilon toxin, they will increase the vascular permeability of the gut. And it will increase, the epsilon toxin is having that peculiarity to increase its own absorption to the bloodstream, which results in toxemia. And the toxemia then will result in shock and death of the animal. That is the pathogenesis of endotoxemia. The clinical syndromes of endotoxemia are categorized into three, like peracute, acute, and chronic. Peracute form is mostly seen in young goats, and as you know, the peracute form means that stage will be only less than 24 hours. So the first symptom of a peracute case of endotoxemia in a herd is that there will be at least one or more dead animals will be found in that herd. That will be the first sign of endotoxemia in a herd. We may not notice any other signs. And the other signs of endotoxemia, the peracute cases of endotoxemia in goats are the sudden loss of appetite, which can range from hyporexia to anorexia, and the animal will be severely depressed and there will be severe abdominal discomfort for the animal. The abdominal discomfort may be manifested as arching of the back or kicking of the belly or looking into the belly, and along with that a loud screaming or bellowing will be there. A loud and painful screaming will be there for the endotoxemia because they will be having severe abdominal pain. And the animal will be having pyrexia. The temperature can go up to 105 degree Fahrenheit. And the animals will be having watery diarrhea. You can even see blood and shreds of mucus in the diarrhea content. The animal will be weak and recumbent and it shows paddling and convulsions. But this may not be seen in all the peracute cases. Sometimes the animal can just go to the coma stage without showing any excitatory signs, and the death usually occurs within hours and recovery is comparatively rare in case of peracute form of endotoxemia. Next is the acute form of endotoxemia. As in any disease, acute form of a disease means the similar signs of peracute, but the signs will be comparatively less. Acute form of endotoxemia are seen mostly in case of mature goats, whereas the peracute was mostly seen in case of younger goats. And the abdominal discomfort will be comparatively less for the acute form of endotoxemia. And the dung will be having a pasty appearance initially, and later it changes to a watery appearance, and the animal will be having severe diarrhea, and this severe diarrhea can lead to severe dehydration and acidosis, and whenever there is severe dehydration and acidosis, it can complicate the disease. The usual clinical course of the disease is 3 to 4 days. If severe or aggressive treatment therapies is followed, it may be possible, recovery may be possible, we cannot assure. And this is a third form. There are three forms, so peracute, acute, and then this is the third form, that is chronic. In chronic form of endotoxemia, there will be intermittent, recurrent bouts of illness. The animal will be showing some signs of illness intermittently, and mostly seen in case of mature animals. The affected animals will be dull or listless, and there will be inappetence or reduced milk production in the affected animals, and there will be progressive weight loss, which may be manifested as emaciation, and there will be pasty or loose pieces in these animals. But this chronic form of endotoxemia is often difficult to diagnose in a herd because the signs are not typical. This is possible. It is possible to diagnose this chronic form of endotoxemia only if we know that some peracute or acute cases of endotoxemia has occurred in that herd. Then only we can think about the chronic form of endotoxemia. So, coming to the postmortem findings of the endotoxemia. So, in endotoxemia, the intestines are the mainly affected organs. So, there will be hemorrhagic enteritis. The hemorrhagic intestines you can clearly see in the picture. And the intestines will be affected. The second picture is of a colon, which is having the walls of the colon are very thickened, which is having fibrinous thread. And the other picture is of kidney, that is the typical of endotoxemia, that is a pulpy kidney. The pulpy kidney occurs because of the protein-rich fluid that occurs in endotoxemia that causes the pulpy kidney appearance. In an acute case of endotoxemia, if you do the postmortem immediately, and if you found the pulpy kidney, we can suspect or correlate it with endotoxemia. But if you go for a delayed postmortem and you are finding the pulpy kidney, that may not be able to correlate with the endotoxemia, because in delayed postmortem, autolysis occurs normally and this pulpy kidney change can normally be there. And another thing is, in peracute cases, the death may be sudden, so they won't get sufficient time to form this pulpy kidney changes. So that change may not be there in peracute form. So for endotoxemia, the pulpy kidney is pathognomonic, but the time of postmortem also depends on that. So you have to correlate with the whether it was an acute case or peracute case, or the postmortem was done immediately after the death of the animal. And this is the pericardium of a goat that is affected with endotoxemia, that is surrounded with the pericardial fluid, and you can see the fibrin attachments in the heart. So this is due to the leakage of due to the damage occurring to the vascular endothelium, there will be protein-rich fluid leakage. So that will be seen in the heart, lungs, in the brain, and in the kidneys. That we are seeing the changes will be seen in these organisms for endotoxemia. So you can see around the pericardium, there is fluid around the pericardium, and fibrin formation can be seen in the pericardium. The second picture, the clot formation in the pulmonary region, that you can see clot formations. And this is pulmonary edema or lung edema in a goat that is affected with endotoxemia. And the widened interlobular septum can be clearly seen in the first picture. And in the second picture, it is froth formation can be clearly seen in the airways. This froth formation in the airways suggests lung edema. So these are the changes. So there will be changes in lung, there will be changes in heart, then in the kidneys and in the intestines for endotoxemia. And coming to the diagnosis of the disease, the diagnosis is mainly based on the history that the owner may be telling one animal has found dead, and by the time I called a veterinarian, another animal also started showing some nervous signs. The animal was healthy. The most important peculiarity of endotoxemia is that it affects healthy animals. The animals that are large or robust, that are aggressively feeding animals will only be affected by endotoxemia because it occurs due to the overeating habit of the animal. The postmortem findings that we have already discussed. And the impression smears can be taken. The impression smears can be taken from the intestines, the open intestines. And when you examine the impression smears under gram staining, you'll be able to see that is teeming with Clostridium organism. The first picture you are seeing is the impression smear that is taken from an endotoxemia affected intestine. That will be steaming with Clostridium organism. The second picture is a normal impression smear that is taken from a normal intestine. That will contain the number of organisms will be less in that. And the clinical pathology, in the CBC, there will be neutrophilic leukocytosis will be there. It is a bacterial infection. And in the serum glucose exam, if you go for serum glucose examination, there will be hyperglycemia. This hyperglycemia is due to the mobilization of hepatic glycogen. This is seen towards the last stages of endotoxemia. There will be hyperglycemia, and acidemia can also be there. And there are toxin utilization assays for the diagnosis of endotoxemia. That is done by collecting the intestinal fluids, and the mouse pathogenicity test will be done and the toxins will be identified. And other tests like modern tests like PCR and ELISA are also being used nowadays for the diagnosis of endotoxemia. Differential diagnosis. So the main disease to which the endotoxemia should be differentially diagnosed are the toxicities. Because of the sudden death and there will be salivation in the mouth, it should be differentially diagnosed from the toxicities like the plant toxicities or the chemical toxicities. In plant toxicities or the chemical toxicities, there will be postmortem changes in the stomach. But in the case of endotoxemia, the rumen reticulum or submersion will be normal and there will be changes in the intestines. So based on that, you can differentiate. When the animal is having diarrhea, that should be differentiated from other diseases, bacterial or protozoan diseases that can cause diarrhea like the coccidiosis, salmonellosis or the colibacillosis. In case of coccidiosis, you can go for a fecal sample microscopical examination to find the coccidial oocysts, and the colibacillus are mostly seen in young ones. And coming to the treatment, the most important treatment is the parental antibiotics. So when we select antibiotics, that should be effective for the gram-positive organisms. Penicillins are the drug of choice for endotoxemia. Even though tetracyclines and trimethoprim sulfur can be used, penicillins are the drug of choice. 20,000 to 40,000 IU per kg body weight is the dose that should be used. So different preparations of penicillins are available, which can be given in or the procaine penicillin or penicillin G sodium preparations are also available. So based on the preparation and the amount of the penicillin that is present in that vial, the dose has to be calculated. And 20,000 to 40,000 IU per kg body weight is used. And intravenous fluid therapy should be given because the animal will be severely dehydrated and acidosis will be there. The intravenous fluid therapy should be given at a dose rate of 120 ml per kg body weight. And along with that, we should consider the hydration status, dehydration status of the animal. And when you go for fluids for endotoxemia, remember, you should not use any fluids which contains dextrose. You should go for normal saline because already there is hyperglycemia in endotoxemia. So you should not go for fluids which contain dextrose. And if the animal is having acidosis, if you check the pH or if it is very low, less than 5, if the animal is having acidosis, go for soda bicarbonate injection. 7.5% is available. The animal will be having severe abdominal discomfort in endotoxemia. So the NSAIDs, non-steroidal anti-inflammatory drugs like flunixin megalodine should be given at a dose rate of 1 milligram per kg body weight. Intravenously or intramuscularly can be given to manage the pain. And there are antitoxins available for the treatment of Clostridium perfringens. That type C and D incorporated antitoxins are available, not that commonly available. For the therapeutic purpose, 100 ml, maximum of 100 ml can be used in a goat. That is, 2 doses can be given, 2 doses of 20 ml. That is 4 days apart, that can be used. Antitoxins are available, which contains type C and D antitoxins. And goats are very susceptible for endotoxemia. So it is essential or it is mandatory to vaccinate the goats against this disease for a effective herd health management. Whole cell culture vaccines, inactivated vaccines of endotoxemia are available. The vaccine name is Rexa-ET, manufactured by the Indian Immunologicals, and other companies are also manufacturing. Rexa-ET is manufactured by Indian Immunologicals, which is a 100-dose vaccine. Primary vaccination should be given at 4 months of age, and thereafter annual vaccination should be done. And when you go for annual vaccination for these animals, preferably it should be given before the start of the season, like May, June, July are considered as the season for endotoxemia, as there will be rain in most of the areas, which will favor the lush green pasture. So before that, you have to give the vaccination. And 2 ml subcutaneous is the dose of vaccine. The vaccine is having a 1-year immunity to go for annual revaccination. And other managemental practices that can be done to reduce the incidence of endotoxemia are avoiding the sudden feed change. The sudden feed change can also cause endotoxemia. So sudden feed change should be avoided. And animals' access to the grains or huge quantities of grains should be reduced. And you should be vigilant about the overeating habit of the animal. And the wilting of the fodder should be done so that it can reduce the incidence. And if the animal is having severe parasitism, the tapeworms are the major problems because they are bigger worms. They can obstruct the intestines. So niclosamide at 50 milligram per kg body weight can be given orally, or praziquantel at 10 to 50 milligram per kg body weight orally should be given. Niclosamide tablets are available, 500 mg tablets. So deworming can also reduce the mortality in case of endotoxemia. Next, we will discuss about the another most common or the most fatal disease in case of goats, the tetanus, or also called as the lockjaw. So the disease is caused by uh, the spore-forming Clostridium tetani organism, which are the gram-positive organism. They also favors an anaerobic environment, and the spores they produce are typical of a shape that is having a tennis racket-like appearance. So these Clostridium tetani organisms are present in the soil. Usually the tetanus infection occurs by the spores of the Clostridium tetani organisms that are present in the soil. Most of the case of tetanus occurs by that means. But the gastrointestinal tract of ruminants also carries some amount of Clostridium tetani organisms, and the organisms that are residing in the GI tract can cause tetanus. That tetanus is called as the idiopathic tetanus. And the main route of infections. So the deep puncture wounds that may be created during the parturition or the deep puncture wounds can favor an anaerobic environment for the multiplication of the replication of the spores. And the umbilical infections, when the kids are born, if the kids are exposed to soil and if the umbilicus is not tied or no disinfectant has applied, the spores can get attached to the umbilicus, and when it dry, the organism can also get inside the body of the animal. And during obstetrical procedures, like if you use any instruments for the obstetrical procedures without proper disinfection, it can introduce spores. And lack of proper surgical disinfection during the surgeries. The spore destruction occurs at only at 115 degrees Celsius for 20 minutes. So if we do the disinfection for 100 degrees Celsius also, the spores won't destruct. So the spores of Clostridium tetani will distress only at 115 degrees Celsius at 20 minutes. So these are the main routes of infection for the tetanus in goats. Coming to the pathogenesis of the disease. So the entry of the organism is through any of the route, through the deep puncture wounds or through the umbilicus or through other obstetrical procedures, the organism has entered. So after entry, the proliferation of the spores which will produce the toxin tetanolysin. That's the first toxin produced, tetanolysin. And this tetanolysin will cause necrosis of the areas. And because of the necrosis of that areas, it will produce another toxin that the Clostridial organism will lyse and produce tetanospasmin, the second toxin, which is the potent toxin, or which is important for the neurological signs of the tetanus. This tetanospasmin, they can attach to the motor end plate, and through the spinal cord, it reaches the brain. And other than that, this tetanospasmin, it can have hematogenous spread also, and through hematogenous spread, by crossing the blood-brain barrier, they reaches the brain. So through both route, the tetanospasmin can reaches the brain, either through attaching to the motor end plates or through the blood, it reaches the brain. So in the brain, the tetanus toxin, it is a zinc-dependent metalloprotease, this tetanus toxin. It attaches and cleaves the synaptobrevin. Synaptobrevin is a protein that is in the brain, which are involved, or which helps in the release of inhibitory neurotransmitters like GABA and glycine. So this tetanus toxin, it cleaves the synaptobrevin. So the release of this inhibitory neurotransmitters, GABA and glycine, will be inhibited. So when the GABA and glycine is inhibited, acetylcholine is the neurotransmitter that causes the contraction of the muscles. So acetylcholine needs GABA and glycine to inhibit, to continue the contraction. So when the GABA and glycine is not there, or when the GABA and glycine is inhibited, the acetylcholine will continue to produce spasms. One after the other, new spasms will come, and there will be superimposition of the spasms that is seen as the tetany. And when the spasms of the respiratory muscle occurs, it will cause asphyxiation and results in death. That is the pathogenesis of the tetanus organism. Regarding the clinical signs, so there will be muscle tremors for this tetanus. The lips, the muscles of the lips will also have tremors. So when the muscles of lip have tremors, the animal will be hungry, so it will take grass, but it won't be able to chew. So often, during the initial stages, the animals will be presented with grass kept in mouth. And another thing is, due to trismus or lockjaw will be there for tetanus, and the animal will be having drooling salivation. And the animal will keep its ears erect and the tail head erect. And in the eyes, if you just tap on the inner canthus of the eye, there will be, you can see the nictitating membrane. There will be prolapse of the nictitating membrane in case of tetanus. So if we tap the inner canthus of the eye, we will be able to see this nictitating membrane. And also, there will be inward retraction of the eyes in case of goats, which is called as enophthalmos. Enophthalmos will also be there. Along with that, prolapse of the nictitating membrane will be there. And the animal won't be able to urinate. During the later stages, the animal won't be able to urinate, won't be able to pass the stools, and all the legs will be stiff or rigid. They won't be able to walk properly. And when they try to lie down, they may just crash to the ground. And later they will remain as recumbent. And when the spasm of the respiratory muscle occurs, which causes asphyxiation and death of the animals. So this typical posture in these goats are called as the sawhorse stance. So these are the classical signs of tetanus. So coming to the diagnosis of tetanus, mainly based on the clinical signs. And a confirmatory diagnosis can be made by the direct smear that is prepared from the wound, or during postmortem, a direct impression smear prepared from the spleen. After gram staining, it will demonstrate the Clostridium organism. But many a times, by the time the animals are presented with the clinical signs, the wounds may not be noticed. It would have healed by that time. And anaerobic culture can also be done. Come to the treatment of tetanus. There are mainly there are three basic principles for the treatment of tetanus. One is the elimination of the Clostridium tetani organism. Second one is neutralization of the unbound neurotoxin and induction of and maintenance of muscle relaxation. We'll be see one by one. First one is the elimination of the Clostridium tetani organism. So this elimination is mediated by mainly antibiotics. So the penicillins are the drug of choice as they act very effectively against the gram-positive organism at the dose rate of 25,000 to 40,000 IU per kg body weight for 5 days. And recently in humans, metronidazole is also used for the treatment of tetanus as it is having effect on the, or it acts well on the anaerobic medium. But reports suggesting the effectiveness of metronidazole in goats are limited. Coming to the neutralization of unbound neurotoxin. The neutralization of unbound neurotoxin can be done mainly using three ways. One is using the tetanus toxoid, an anti-tetanus serum or the tetanus antitoxin, and using the tetanus immunoglobulin. First one is the tetanus toxoid. So tetanus toxoid is the inactivated Clostridium tetani organisms. The toxins from the Clostridium tetani organisms, they are just inactivated using formaldehyde and adjuvated in the aluminum hydroxide. That is a tetanus toxoid, which is available as a 0.5 ml ambule that is used for the active immunization of goats. And the content is, it contains 0.5 ml of the tetanus toxoid contains 5 LF is a flocculation unit, 5 flocculation unit of the tetanus toxoid. And the dose is 0.5 ml deep intramuscular, the dose, that is the tetanus toxoid. So this tetanus toxoid should be given to the animals that are presented with the signs of tetanus because the tetanus is a disease which won't provide immunity to the affected animals. So once the animal recover also, there won't be any immunity for that animal against the disease tetanus. So tetanus toxoid is mandatory. Next one is a tetanus antitoxin. Tetanus antitoxin is same as a, or the other name is a tetanus anti-tetanus serum. So this is prepared by injecting the horses with tetanus toxoid and the serum will be collected and that is used as the tetanus antitoxin. But it is not that well purified. It may contains antibodies against other diseases also. So it can cause anaphylaxis. So this tetanus antitoxin is used for the passive immunization of goats. The dose is 10,000 to 15,000 units, intramuscular or subcutaneous. It should not be given IV as there are other antibodies also. It can cause anaphylaxis. And for the first 24 hours, it should be given every 12 hours. And this tetanus antitoxin is available as 50 ml vials. The 1 ml contains 1,000 units. That is a tetanus antitoxin or the anti-tetanus serum. This is costly. The third one is a tetanus immunoglobulin. The tetanus immunoglobulin is produced by injecting the horse with tetanus toxoid and later collecting the serum and purifying it. So this is a purified one. So it is safe to use. It won't contain any other antibodies. It will be against the tetanus only. So human tetanus immunoglobulins are available easily. 100 international units per kg body weight intramuscular or subcut is the dose. This should be used during the early stages of the disease. And the success, we cannot assure that it will be a success. And at least 3 to 5 days, the treatment should be given. So 250 IU or 500 IU presentations are available. It is costly. So based on the circumstances or the interest of the owner, we may think of these options. So there are three principles for the treatment of tetanus. The third one is the induction and maintenance of muscle relaxation. So this is done by using anticonvulsants or tranquilizers or by using muscle relaxants. Chlorpromazine can be used at the dose rate of 0.4 milligram per kg body weight intravenously or 1 milligram per kg body weight intramuscularly 3 to 4 times a day. Azithromycin at a dose rate of 0.2 milligram per kg body weight intramuscularly BID for 8 to 10 days or till the signs are disappeared. And diazepam can also be used at a dose rate of 0.5 to 1.5 milligram per kg body weight intravenously. And there's a drug called methocarbamol. It is a centrally acting muscle relaxant. it acts on the internuclear neurons of the spinal cord. So it is very effective in causing the muscle relaxation and reducing the spasms. The total dose per day is 100 to 120 milligram per day, or 22 milligram per kg body weight is the dose. So 500 milligram tablets are available. Robinax is one preparation. So these are the muscle relaxant drugs that can be used. It is important to reduce the muscle spasms because the spasms of the respiratory muscles cause asphyxiation and death of animals. So to prevent that, we need to use this muscle relaxants. Then about the chances of recovery in tetanus. There are certain cells called Renshaw cells in the brain that helps in the release of this glycine and GABA. This Renshaw cells has the ability to regeneration of nerve terminals. It is possible in the Renshaw cells. Only if, but the regeneration of the nerve terminals requires 15 to 17 days. To the neurons where the tetanospasmin has bound, we cannot regenerate that. That is already bound. We cannot do anything with that. But these Renshaw cells can regenerate. So if you could maintain these animals for 15 to 17 days, there is a possibility recovery in tetanus. This is possible in case of humans because they can sedate the humans and they will provide the ventilator support, and by which they are reducing the mortality. In human cases, tetanus cases, the mortality is very less. But in the case of animals, maintaining the tetanus animal for 15 to 17 days is not that easy with the reduced facilities. Because the animal should be kept in a dark, quiet surroundings, and there should not be any stimuli from the light or the sound stimuli should not be there. And the intravenous fluids should be provided containing dextrose, or the electrolytes should be provided. And enema should be given to relieve the constipation in these animals. And urinary catheterization may be required because the animal won't be able to pass the urine. And the position of the animals should be changed after some time because to avoid the chances of decubital ulcers. And because of the lockjaw, the animal may not be able to eat food. So the nasogastric tube should be placed to provide the nutritional support. So if you provide all these supportive care for 15 to 70 days, there is a chance of recovery in case of tetanus. For the prevention of the disease, hygiene and immunoprophylaxis are the most important aspects for the prevention of tetanus. Any wounds should be cleaned promptly and thoroughly because wounds are the main route by which the tetanus spores enters. So when an animal is presented with a deep puncture wound, you need to administer prophylactically penicillins and tetanus toxoid. And tetanus antitoxin and tetanus immunoglobulin can also be used prophylactically if the wound is sufficiently deep and you suspect a tetanus. In that cases, 150 to 750 units of tetanus antitoxin can be used prophylactically, and 80 IU per kg body weight of immunoglobulin can be used prophylactically. But the economics or the financial conditions should be considered. Mostly you can manage effectively with penicillins as well as the tetanus toxoid in case of deep puncture wounds. And the use of elastic bands for the castration should be avoided. They are a major source of tetanus spores. And before going for any surgical procedures in case of goats like the castration or docking or any other procedures, a tetanus toxoid should be given. And umbilical area, the farmers should be clearly advised to disinfect the umbilical area or to cut the umbilical cord and to disinfect and use iodines. And the animals should not be led to the soil immediately after pasturation. So such advices should be given to the farmers. So regarding vaccination of tetanus toxoid, different agencies advocate different schedules for the vaccination of tetanus toxoid. Different articles are there. Different agencies advocate different schedules also. So the kids usually can be vaccinated at 3 to 4 weeks of age, and a booster should be given after 1 month. Then they should be vaccinated annually. Annual vaccination should be done. And for the pregnant goats, if they are becoming pregnant for the first time, a dose of tetanus toxoid should be given at the 3rd month of pregnancy. And again, at the 4th month gestation, again, a dose should be given. But in the case of in the subsequent pregnancies, at fourth month of gestation, one tetanus toxoid is enough. And if the kids are born to mothers, dams that are not vaccinated, you can vaccinate the kids at 7 to 21 days, between 7 to 21 days of age. You can vaccinate the kids and the booster should be given and the schedule should be followed. So 3 to 4 weeks of age, then booster after 1 month, then annual vaccinations for normal kids. And if the doses are not vaccinated, kids can be vaccinated at 7 to 21 days of age, and the booster should be given and annual vaccination should be done. For all these cases, the dose is 0.5 ml intramuscular. Now I'm going to discuss about some other Clostridial diseases which are not very common in goats, comparatively less in goats compared to the sheep or cat. The first one is a big head disease, also called as a swollen head disease, that is caused by Clostridium novae, mainly caused by Clostridium novae type A, but Clostridium septicum or Clostridium sordile organisms are also been identified from these conditions. And this is mostly seen in case of bugs which are group based. The bugs that are reared in groups, it will be mostly seen because this organism, the Clostridium novae organisms are present in the soil. In the group-based bugs, there will be fighting or headbutting is common. So there will be chances of injury. So the spores of these organisms that is present in the soil can easily enter. That's why it is mostly seen in bugs. So during any fighting or headbutting, it will favors the introduction of spores and that will result in a condition called the big head disease. So whenever there is a tissue damage, there is possibility of creation of anaerobic environment, which will helps in the proliferation of the organisms. So they will produce toxin. These toxins will cause severe localized inflammations as well as generalized fatal toxemia. And due to the severe localized inflammation, there will be edema formation and gas formation. And usually the subcutaneous tissue and the connective tissues are affected. In the case of big head disease, muscles can also be affected. So there will be large edematous swelling. The swelling will start from the around the eyes, then it spreads to the face, then to the neck, and sometimes the swellings can reach up to the chest. Then because of this swelled appearance, the animal will be having a disfiguring look. And because of the huge quantity of edema fluid that is present in the face, there will be the skin will crack and the fluid will seep that through that facial regions, and the animal will be depressed and weak. And because of the huge amount of the edema fluid that is present in the head, it will keep its head low, and the animal will become recumbent. And due to the fatal toxemia, the animal will die within 1 to 2 days. So coming to the diagnosis of the disease, mainly diagnosed based on the clinical signs, the swell head appearance, or the yellowish colored edematous fluid that is oozing from the face. Then on necropsy also the yellow serosanguinous edema fluid can be seen, and can take impression smears from that serosanguinous fluid, and gram stain it can identify the Clostridium novae organisms, and anaerobic culture can be done for the diagnosis. So for the treatment of this disease, the skin over this affected areas should be incised so that so as to drain the edematous fluid and gas will be there in that region, in the head region. So we can drain that fluid as well as that gas, and it will provide some aeration for the underlying muscles. And penicillins should be used. They are the drug of choice. 20,000 IU per kg body weight every 6 to 8 hours. Either benzyl or procaine penicillin or penicillin sodium should be used. Along with that, fluid support should be given. And the animal will be having a severe inflammatory response. And the animal will be having severe pain. And so steroids as well as non-steroidal anti-inflammatory drugs like flunixin meglomin can be used. Solely supportive therapy. So coming to the next disease, infectious necrotic hepatitis. This disease is also common in case of sheep than in goats, Disease is being reported from goats, but incidence is less. This disease is otherwise called as black disease. And the disease is caused by Clostridium novae type B. Type A causes big head disease and the type B causes this infectious necrotic hepatitis. This disease is mostly seen in areas where there is a severe fasciolosis infestation, liver fluke infestation is there. In that area, this infectious necrotic hepatitis is mostly seen. So this fasciolosis, liver fluke will cause injury in the liver, which predispose the animals to get this disease. So the organism is present in the soil as well as in the gastrointestinal tract. The infection occurs by the ingestion of the spores that fecal-oral route of transmission occurs. So the ingested spores, they go to the gut and escaping from the gut, they go to the liver. And these organisms remain dormant in the liver till they get a favorable environment. And the sporulated spores are seen within the Kupffer cells. They germinate in an anaerobic environment. The anaerobic environment is created by the liver flukes that cause injury in the liver. They create an anaerobic environment. And when we attempt liver biopsy, there can be injury. And due to any other infectious diseases, injury can occur in the liver. And whenever there is an anaerobic environment, there is germination of this Clostridium novae organism, which causes local necrosis and widespread damage to the microvascular system. So when there is damage to this microvascular system, there will be subcutaneous bleeding. And this subcutaneous bleeding will cause blackening of the skin. Hence, the disease is called as black disease. So when the carcass is seen, it will be having a whole black appearance because of the subcutaneous bleeding. And the clinical signs are not clearly reported in case of goats because the disease is comparatively less and the clinical course is usually less than 1 day. And mostly we may not identify infectious necrotic hepatitis as the cause of the disease before death. It may not be possible to identify. Anorexia may be seen and the animal will show debility, generalized weakness, and the animal will recommend. And because of the toxemia, the animal will die. It is a severe fatal disease. And before 1 day, the animal will die. And this is the most important postmortem finding of infectious necrotic hepatitis. As the name suggests, there will be severe hepatitis. And along with that, the carcass will be having a black color and a straw-colored fluid will be seen in the abdominal cavity and there will be severe bleeding in all the cases. These are the important postmortem findings. So the antibiotics that should be used are the penicillins are the drug of choice, 20,000 to 40,000 IU per kg body weight every 6 hours. And flukicides. Flukes predispose the animals for the infectious necrotic hepatitis. So flukicides like tricarbendazole at the dose rate of 10 mg per kg body weight orally can be used. That is 1 ml for 5 kg body weight. Triclama preparation is available, which is 50 milligram in 1 ml. And supportive care should be provided like the fluids, electrolytes, nutritional support, and NSAIDs should be given. And the flu control is important for the control of infectious necrotic hepatitis. The flu control involves the controlling of the snail population. The animal should not be sent for grazing to waterlogged areas. And other chemicals like copper sulfate can be used for the destruction of the snails. And when animals are provided with fodder, they should be wilted so as to reduce the snail population. So such flow control methods can reduce the incidence of infectious necrotic hepatitis. The next important disease is blackleg. So blackleg is also not a common disease in case of goats, but has been reported from goats, mostly seen in case of cattle and sheep because blackleg occurs in the muscles. So these goats don't have a big muscle mass. So comparatively less in goats. Disease is caused by the Clostridium shawai organism, highly pathogenic organism. They are gram-positive, anaerobic, spore-forming organism which produces gas. The organisms are present in the soil. The animal will get infection by the ingestion of spores. So once ingested, the spores, they go to the GI tract. From the GI tract, it goes through the lymphatics and it escapes from the GI tract and goes to the lymphatics and blood. It will reaches the muscle tissue and it will remain dormant. And whenever there is a muscle trauma, the organism will proliferate and it will produce a toxin. The toxin that produces of necrotizing myositis. That is the main um, thing that happens in black leg disease, which results in fatal toxemia. And the clinical signs are regional painful swelling can be noticed in case of black leg, and the animal will be having lameness, and there will be subcutaneous gas formation. Because of the increased gas production by these toxins, there will be subcutaneous swellings can be seen in the goats. Along with that, there can be udder swelling as well as there will be fetid discharges from the vulva as well as the udder. So that are the clinical signs that are seen in goats with black leg or black quarter. So diagnosis is mainly by the clinical signs. Then in postmortem, crepitant swellings may be able to identify, and there will be gas bubbles in liver, kidney, and in the uterus. And the gram staining of the impression smears will reveal the rod-shaped Clostridium shower organisms, and anaerobic culturing can also be done for the diagnosis of the disease. And the treatment involves mainly wound management and antibiotics. That penicillin should be given at a dose rate of 20,000 to 40,000 IU per kg body weight intravenous every 6 hours. Nutritional support should be given by placing an esophageal tube, and fluids and other electrolytes should be given. The animal will be having severe pain, so anti-inflammatory agents should be used. And maintenance of hygiene is of utmost important to prevent the entry of this organism. So HSBQ vaccines are available for cattle, not being used in case of goats. The next important disease is Bacillary hemoglobinuria. This disease is also reported from goats, but is most commonly seen in case of cattle and sheep. The disease is also called as red water disease. It's caused by the Clostridium hemolyticum organism, which is seen worldwide. And disease causes acute toxemia. This is also seen in fasciolosis affected areas. And the source of infection of red water disease is mainly alkaline pastures that are with the standing water. Alkaline pastures with standing water are the main source of infection for this disease. The infection occurs by the ingestion of the spores. So the spores are ingested, the spores go to the gut, and escaping from the gut, the spores go to the liver of healthy animals. So whenever there is a liver injury due to this fasciola or due to other infectious diseases, and these flues can also carry infectious organisms. And when we attempt for liver biopsy, there can be injury. So whenever there is a liver injury, there will be an anaerobic environment is created, which helps in the proliferation of the Clostridium hemolyticum organism. This Clostridium hemolyticum organism produces beta toxin. This beta toxin causes intravascular hemolysis that damage the capillary endothelium, and it causes anemia, hepatic infection, and it causes acute hepatic necrosis also. So the organisms stay dormant in the liver of healthy animals. So whenever there is a liver injury, the Clostridium hemolyticum organism proliferate and produce a toxin, beta toxin, which causes intravascular hemolysis and acute hepatic necrosis. So because of the intravascular hemolysis, there will be port wine colored urine, and feces may also be mixed with blood. The animal may be appear as weak and depressed. And during the early stages of the disease, pyrexia can be seen, but during the late stages of the disease, jaundice is seen mostly. And death usually occurs within hours to few days. So which results in the anemia as well as the hepatic infraction, then hemorrhagic enteritis. So in the hematology, there will be severe anemia will be there, and hemoglobinuria can be seen. And on postmortem, there will be severe hepatic necrosis. Hepatic necrosis will be seen because the toxin causes acute hepatic necrosis. So the liver will be affected. That is the reason for the jaundice during the late stage of the disease. And confirmatory diagnosis by the anaerobic culture of the Clostridium hemolytic organism. And treatment is mainly penicillins, that 20,000 to 40,000 IU per kg body weight every 6 hours. And fluicides should be used because they are the main predisposing factors for this disease also. And disease is most commonly seen in areas where there is a heavy liver fluke infestation. So triclomendazole can be used as a fluicide at 10 milligram per kg body weight orally. And anti-inflammatory agents like NSAIDs, clonexamoglobin or meloxicam should be used. And in case of severe anemia, you need to go for blood transfusion. And if the animal is severely dehydrated, fluid therapy may be required. And for the control of bacillary hemoglobinuria, we need to control the liver flukes by controlling the snail population, that by not allowing the animals to graze in waterlogged areas. And the fodder that are provided the animals should be wilted to reduce the snail population. And chemical treatment using copper sulfate may be done to control the snails and prevent the other causes of liver damage. And the Clostridial polyvalent toxins are available. And coming to the last disease of this section, that is the botulism. That is a disease which causes fatal paralysis. And the peculiarity of botulism is that for all the other diseases that we have discussed, that is ingestion of the spores or entry of the spores that has caused the disease. But in the case of botulism, it is the ingestion of the preformed neurotoxin that causes the disease. It is a toxicosis. We are ingesting the neurotoxin. The animals are ingesting the neurotoxins. So the disease is caused by the Clostridium botulinum organism, which are gram-positive, rod-shaped, spore-forming organisms. And there are 7 neurotoxins that are produced by the Clostridium botulism organism. That are from A to G. And this disease is reported in goats, but it is really uncommon. The toxins that are elaborated in goats are the C and D toxins. So the source of infection for this disease is decomposed carcasses and decayed vegetations. They act as a source of infection. And in these decomposed carcasses or in the decayed vegetations, the spores will be there in the soil, and the spores will enter this decomposed carcass or decayed vegetation where they proliferate and they produce the stable neurotoxin inside this carcass. And this carcass, this neurotoxin is ingested by the livestock. And the feed and water sources that are contaminated because of this decomposed carcass is an important source. So, decomposed carcass or the vegetation, the spores that are present in the soil enters this carcass or the vegetation. There will be germination of these spores and they release stable neurotoxins like the C and D neurotoxin in the case of sheep and goat. So the goat will ingest this toxin and this toxin binds to the lower motor neurons and it blocks acetylcholine, which causes flaccid paralysis. And when there is flaccid paralysis of the respiratory muscle occur, it causes asphyxiation and death occurs. And the clinical signs are depend upon the dose of toxin that is ingested. So based upon the dose of toxin that is ingested, the signs can range from peracute to chronic. The signs that are documented in goats reports are very, very less. The signs that are documented in goats are restlessness, reluctance to move, and the animal will be having a stiff gait and muscle tremors with bruxism. This grinding of teeth will be there, and the tongue will be seen outside the mouth with foaming at the mouth region, and the animal will be recovered in the later stages. Paddling of limbs are noticed, and death occurs. So these are the clinical signs of botulism that are seen in the goats. So in the first picture, the white goat, you can see that animal is not the muscle weakness, general muscle weakness due to the flaccid paralysis that is caused by the botulism organism. In the picture B, the second picture, you can see the twisted neck of the animal, and also the animal is recumbent due to the paralysis. And in the picture C, the third picture, you can see the animal is touching its head in the ground, and the animal is recumbent. And the fourth picture, you can see the clearly twisted neck that is caused by the botulism toxin. So this is a reported case of botulism that has occurred by osteophagia. These goats had phosphorus deficiency. So they had osteophagia. So they had ingested the contaminated carcass, parts of some carcass, and the toxin has gone, and the death of some 30-40 animals had occurred within a single night. Death occurred in most of the animals, and some animals showed clinical signs for 1 or 2 days. So that is also a reason. So the diagnosis of disease is based on the history. So we need to identify a presumptive diagnosis of botulism can be arrived only based on the identification of a feed source or a water source uh, that is contaminated by a carcass from a mammal that should have been that should contain some this Clostridium botulism organism. So only identifying such feed sources, we may be able to reach the diagnosis of this botulism. And along with that, the animal may be showing rapidly progressing generalized weakness. There is no specific necropsy finding, so there is no characteristic laboratory findings for this botulism. And the treatment, the prognosis is usually grave. Maintenance of hydration or an esogastric feeding should be done, and the animals should be kept in slings to avoid the decubital ulcers, and that should be done. Only the symptomatic palliative care kind of treatment should be given for the treatment of botulism. And the control is this is a sporadic disease, and the phosphorus in diet. So osteophagia has got the has caused the ingestion, resulted in the ingestion of the decomposed carcass that is due to phosphorus deficiency. So in that reported case, they have investigated that the fodder that has been regularly given to that group of goats, they that contained a huge quantity of calcium and very less quantity of phosphorus. And also they investigated that the soil in which these animals are reared contained very less quantity of phosphorus. So the animal had hypophosphatemia, which resulted in the osteophagy, which caused the death of animals. So routine checking of the feed and water resources should be done, because some cases has been reported from contaminated water sources, like well has been contaminated due to a decomposed carcass, and that has this botulinum, and such reports are there. So coming to the conclusion of the Clostridial diseases of goats. So there are various Clostridial diseases in goats, which we have already discussed, like the endotoxemia or the tetanus, the big head disease, or the bacillary hemoglobinuria, infectious necrotic hepatitis, botulism. So among this, endotoxemia and tetanus are the most common disease that are seen in our areas. And prevention is always better than cure. So these diseases has to be controlled by routine vaccination. For both endotoxemia and tetanus, effective vaccinations are available. So it has to be controlled by effective vaccination schedules. And for the other diseases, for the other Clostridial diseases that we have discussed, for that diseases, currently we are not using any vaccines for those diseases, because that the reports of that diseases in goats are comparatively less. So based on the reports of such diseases in goats, and considering the economical aspects of the time, we may need to think whether such vaccines should be incorporated. Such multi-component Clostridial vaccines should be incorporated in the current or the existing vaccination schedule of this endotoxemia or tetanus. And the zero-grazing system. So the zero-grazing system as a system in which the animals are maintained in stalls or areas. That's intensive care, intensive system of rearing. They won't be let out much. And in the zero-grazing system, we can reduce the incidence of Clostridial diseases along with the vaccination and other measures. We can reduce the incidence of Clostridial diseases by following this zero-grazing system to make goat farming a profitable one. With this, concluding my presentation. Thank you all.